Good morning. Hello. Have we had someone join us?
Are you still on mute?
No. Good morning. Hello. Have we had someone join us? That's you, Kat. Yeah. This person's been online. I just mute myself. Morning, Shirag. How are you?
Oh, morning. I'm good, thanks. How's everyone?
Yeah, good. Thank you. We've just got a few more minutes to go before we we'll start. So I will just mute myself for now.
Cool.
That's okay?
Yeah.
Good morning, everyone. Welcome to the QGHA webinar for Round 2 Clinical Projects. I just want to do a quick check and make sure everyone can hear me. I know quite a few of you are muted at the moment, but is the sound okay?
Yep.
Yep.
Yeah.
Great. Okay, so I'm now going to mute all participants. This is because the webinar today is a slide presentation, and after the presentation we'll unmute everyone so that you can ask questions. We'll also take questions through the chat function on the Zoom meeting. And so I'll answer the chat questions first that come through, and then we'll unmute everyone so that you can ask verbally. Today is a slide presentation, as I said, so these slides will be made available on our website. And any questions that you might ask or someone might ask from today's webinar, along with the webinar we're having at midday, will be uploaded as FAQs along with the slide presentation and the recording mid next week onto the QGHA website, qgha.org. If we can't answer your questions today, we'll take it on notice and we will send you a personal response, as well as make the answer available via those FAQs on the website. Please remember throughout this whole process of developing the clinical projects that the QGHA Business Team is here to help you develop your EOIs. As part of our team, we have 2 genomics advisors, both coincidentally called Helen. That wasn't done on purpose. Helen Gunter is a PhD with expertise in sequencing and sequencing technology. And Helen McCarthy is a nurse of 20-odd years experience, and she's also a genetic counsellor, so she can really help with any questions you might have about Queensland clinical settings. I myself bring expertise in multi-site clinical service design, models of care development and broad health system knowledge, particularly Queensland focus. So if you would like to talk through your project at any point, please contact us at projects at qgha.org, and we would love to spend the time learning about what you want to do. We are recording today's session, just so FYI, and as I said, that will be made available on our website mid next week. So what are we going to cover today? I'm not going to go into finite detail with each document that you see on the screen. It will be a broad overview where I'll try and give you some tips and advice as you step through the process to apply for a clinical project. So we'll start the session with a refresh on our focus for round 2. We will look at the overall gate process for clinical project applications. We'll talk through how decisions will be made in round 2, and then we'll do a deep dive into the clinical project investment streams and the project investment specifications, which really are your criteria that you must address as part of your EOIs and ongoing through the gates. And then we'll talk a bit more about the EOI application and what level of detail is required. So in round 2, QGHA has really undertaken a significant shift. In round 1, our focus was on initial research, demonstration and discovery. And now we've really made this significant and important shift to patient outcomes and clinical practice. So that means we're focusing on sustainable application of clinical genomics. We're looking to incubate projects for our next round of funding and possible other funding sources. And then we're going to be wanting to look at innovation within the clinical setting, as well as our second program for round 2, which is targeted health system capability building within particular areas of Queensland Health core function. So as I said, it's a shift from research evidence development to applying well-evidenced clinical knowledge in actual clinical settings, and moving to commissioned activities in our second program of funding in round 2 that support the enablement and the building of capability within Queensland Health core functions. Just bear with me a moment. Now, how are we going to go about building round 2 clinical application processes? Now, as you look at this slide, you're probably going, wow, that's a lot of information, and that's quite an overwhelming process where I'm committing myself from June through to November, December. And the real idea behind this process is that we take the time to thoroughly build your application and your projects so that when you are ready to start, you are really ready to start. In round 1, we had a lesson where we expected everyone to be able to kick off from the date of selection, and it didn't really resolve itself that way. You know, there was a lot of startup that was required. So we're hoping to bring all of that work forward, and we really want to increase your chances of having your project impact upon clinical care and the healthcare system, and we really want to see your project deliver benefits for patients. So Gate 1 opened on the 1st of June. It is an expression of interest, and we've made that process fairly lightweight, and we'll talk you through that in a moment. The EOI is really about you describing your vision and the core objectives for the project and how you will deliver outcomes and benefits within our core, our key outcome themes that we have here at QGHA. The EOI closes on the 29th of June. And then we'll have a review period of 2 weeks before we open Gate 2. Gate 2 is about clinical utility, and here is where we check, you know, have you got the clinical leadership present that we know needs to exist in order for projects to be successful? Do you also have the health system sponsorship? So are the administrators and executives of the services that you want to impact upon really supportive of your project and willing to sign up and commit to sustainable funding for this service? And then the other element we'll check in clinical utility is this relevant for healthcare now? Is this something that healthcare really needs to address? Gate 3 will look at partners and capability, and we'll bring here in research, industry and community partnerships. And we'll also look at how we can support you out of our second program of funding around capability building in Gate 3. All of this work will culminate in something, and that something is a business case. And the business case will be refined and finalised in Gate 4 before a final investment decision by Queensland Health at the end of the gate process in around November, December. So here's the key dates for the first gate, the expression of interest. So as I said, it opened on the 1st of June. The EOI guidelines and templates have been released and they're available on our website. The EOI is, the important date for the EOI is the close date of the 29th of June, and I really must refer your attention to the midday deadline. This is an important timeline, so please schedule midday into your diaries for submission. We have pretty stringent internal timelines in which we have to turn around all these applications to our advisory panel. So at the stroke of midday on the 29th, we're going to begin collating all the submitted applications, and for fairness, we can't provide extensions to any projects. And so those who submit past midday, we just can't include in the advisory panel pack. We'll have a 2-week review period, and then on Friday the 13th, we will be notifying applicants on whether they've progressed to Gate 2. And we'll also be releasing the template for Gate 2 at that stage as well. So you'll have clear documentation that you need to complete for each gate. You won't have to try and devise and figure out this documentation yourself. Now, these templates won't be unfamiliar to clinicians, as these templates are based on business cases and service requirement templates that are currently in use by hospital and health services. We've just refined what already exists for our needs. We'll provide definitive dates and timelines for the subsequent gates as we proceed. But you can anticipate that each gate will be open for about a month. Then following the close of the gate after a month, there'll be a 2-week review period by the advisory panel and the oversight group, and I'll talk through that process in more detail shortly. You are very welcome to anticipate future gate requirements and begin work. However, this might not be a great investment of your time. We're keen to help you move through future gates and work with you on the templates. This is a key element of the co-design process that we have built into the round 1 application process. So we didn't want to have you adhere to a really rigid process, so that's why you're not going to be getting templates right now and having to try and adhere to those when the situation might change as we move through the gates. And that's the whole point of co-design. So as I've alluded to earlier, there is a review process at the close of each gate. The first step will be to review each applicant's completed gate documentation by an advisory panel. This advisory panel, we're pulling it together at the moment, and it will have standing members representing key areas of Queensland Health who will provide advice and recommendations to the QTHA Governance Oversight Group, and I'll get to the Oversight Group in a second. And then depending on the gate, we will call upon expert members in that area to add to the advice and recommendation of the standing members. For example, if your application is a cardiac project, then we will ask the statewide cardiac network to provide a representative to review your application as part of Gate 2. Following the review process, the recommendations and advice will be provided to the QTHA Governance Oversight Group, who will determine which applications proceed to the next gate. The Oversight Group may also place contingencies upon a project from a previous gate to be included in the workup for the next gate. For example, after Gate 2, which is the clinical utility gate, they may ask you to reconsider a referral pathway or amend a recruitment protocol based on the advice from the advisory panel. And this work will need to be addressed as part of your submission for Gate 3. So not only will you have the documentation for the partners and capability work that you may need to do for Gate 3, but you also might have to do some revision work from Gate to the clinical utility gate. Again, this is another important element of our co-design process, and it's all geared towards making sure your application is as good as it possibly can be as we move through the process. If you have been involved in QGHA previously, you may be wondering by now why our Executive Director, David Bunker, is not delivering this webinar. The reason for this is David sits on the Oversight Group and will therefore play a role in gate decisions. For probity, David has stepped aside from the Round 2 clinical project process, and I'm leading this, which is helpful because I was the designer of the process, so if you don't like it, please complain to me. If you do want to tap into David's particular expertise, you may, but please contact projects@qgha.org and our team will facilitate the interaction and participate in that meeting. The discussions applicants have with David will be written up as FAQs and provided to all applicants via the QGHA website so that everyone gets access to the same advice. Now, the chair of the QGHA governance group is Professor Keith McNeil, and you may remember Keith from such organisations as the Prince Charles Hospital, where he was a thoracic physician, and Metro North, where he was the inaugural chief executive. And Keith has returned from the National Health Service as their Chief Clinical Information Officer to Queensland Health, again in the role of Chief Clinical Information Officer. And he brings a wealth of expertise in genomics and clinical practice and health system leadership to our oversight group. It's through Keith that all the work that we do through the gates and the final business cases will go to Queensland Health for a decision and a final outcome. This investment decision will encompass the full $6 million program for round 2. So we have $3 million for the clinical projects to distribute and $3 million for the capability program also that will be commissioned. So Keith will take that full $6 million program forward to Queensland Health, and Queensland Health will make the final call on what projects get selected. So with $3 million on offer in the clinical projects, let's talk through the opportunities that are available. There are 2 streams for the clinical projects. The first stream is a clinical implementation or incubation stream. And this is really about projects that are very close to landing in the healthcare system proper, but need time to trial or pilot the application to test out some of the kinks in the system. So we've got space for 2 clinical implementation projects, and these 2 projects must be ready by December 2018 after they have gone through the gate process to apply well-evidenced clinical knowledge. Now, this may be from other genomic alliances or something that's happening in another hospital service elsewhere in Australia or the world, and it's ready to be implemented proper into Queensland Health System. Now, we also appreciate that there's only 2 of those projects, and there may be some projects that just aren't quite ready for December 2018, and they require a little bit of readiness investment to get them ready for either round 3 QTHA funding or to become business cases in their own right to put forward to the hospital and health services themselves. So we'll also be funding some incubation projects to get them ready for the next phase of implementation. We will be asking those clinical implementation and those incubation projects to align to the preferred workforce model that Queensland Health has designed for their genetics services. And I'll just flick quickly to that slide so I can talk you through that. The key areas of this slide, and my apologies for the graphic, it's not our graphic, so it is a bit difficult to read, but we're really looking at the 3 sections at the bottom of the inverted pyramid. So we want to know about, we're hoping to see projects pitch in the space of mainstream specialist services, joint services, or specialist services. So I do refer you to the model. It's in the EOI guidelines to shape up how you might put forward a clinical implementation or incubation project. We'll talk through more of the specifications shortly. I'll flip back to the other slide now, apologies for that. In stream 2, we are looking at clinical innovation, and we're really wanting to identify and investigate the potential of genomics in new specialty areas and emerging models of care in clinical practice. Now, with the clinical innovation and the clinical incubation projects, how many we fund is dependent on how much funding projects ask for, the potential outcomes that funding will deliver, and the number of applications. Now, obviously, we can't fund everyone because in that space, we only have about $1 million to work across both those types of projects. But we certainly want to see the ideas come through because they may be picked up else in other buckets of funding. So please keep those ideas coming forward. I'll move now to just a bit more information about those 2 streams. So 2 clinical implementation projects, up to $1 million each for the clinical implementation projects, but those projects will run up to 24 months. So they're slightly longer, so you really have a good chance of getting those services into clinical practice proper. The clinical incubation projects up to 6 months, so we won't be dragging those out forever because we really want them ready to kick off when our next round of funding starts mid next year, so mid 2019. And then our clinical innovation projects will be up to 12 months. All of these investments will be decided through the gate process, with the investment decision made by Queensland Health following the finalisation of the gate process. Now, you can submit multiple applications in each stream. Please note, please make sure you note on the cover page of the EOI which stream that application is for. It's not possible to submit the same application for each stream. If you're wondering which stream your project is, then please be sure to read in depth the investment specifications. This is why it's not possible to submit the same application for multiple streams. And it's really important that applications are submitted in accordance with that stream's investment specifications. So a deep dive into those project specifications is highly recommended. Now, there are two types of specifications, and these align to the clinical project streams. So I've just pulled up here the essential criteria for the first stream, which is the clinical implementation and incubation stream. I'm not going to talk through each dot point. I'm just going to give you a high-level overview and pick up on some of the queries that have come through already. You'll note the essential criteria requires consideration of core Queensland health functions such as the digital hospital rollout through the IEMRs and advancing investment in genomic capability in Pathology Queensland. There's been a number of questions about whether this Queensland health focus precludes private providers from participating and applying for clinical implementation or incubation projects. And the answer is no, it does not preclude private providers from applying, but as this is Queensland Health funding, there's a need to ensure these projects can advance those elements identified in the essential criteria. This does not mean you must use Pathology Queensland as your service provider or public hospital IEMRs, but private provider projects will have to demonstrate how their project's outcomes will advance investment in core Queensland health functions. Now, also in this space, a key point that I want to direct your attention to is these projects must be led by a practicing clinician within the specialty area identified. This is a shift from round one, and it's an important point to note in the clinical implementation and incubation projects. Now, if you're unsure of what we mean by a practicing clinician, please get in contact with us, but it really does mean, you know, someone who is on the floor, seeing patients in clinics, doing ward rounds, on call on weekends. It's really that kind of clinician that we're looking for. Now, that means you are super busy because you actually have a day job. So please factor into your application how you might support, lead such a project if you're already a busy practicing clinician. But we can talk through the requirements around that out of session if you wanted to know more detail. Now, this slide here separates out the undesirable criteria for the clinical implementation and incubation projects. This section highlights patient communities, disease areas, clinical specialties, and genomic services that Queensland Health would like to see in the clinical implementation and incubation space. These areas have been identified through consultation with the hospital and health services and aligned to Queensland Health strategies and clinical service plans that are developed in Queensland Health. Now, we've not just gone, here's the health need and everyone try and meet these. We've also matched these needs with an assessment of whether there is genomics ready to be implemented in a clinical setting. So you won't see the full gamut of Queensland Health needs here because from our analysis, there's just not genomics ready to be applied. You can weave a scenario through these desirable criteria and describe a project that enables equity of access for Aboriginal and Torres Strait Islander patients with renal disease using whole genome sequencing, or you could choose to focus on only one key area, or you can put forward other patient communities, disease areas, or clinical specialties and genomic services that you think should be addressed in the implementation and incubation. However, to pass through Gate 1, you must have addressed the essential criteria that was on the previous slide. We'll move on to the section now that describes the type of projects we will or will not fund. We've described this as in-scope and out-of-scope projects. Within the clinical implementation stream, the in-scope section describes must-haves, and a key must-have is that you must be ready to go by December 2018. If your project still isn't quite ready or you can't demonstrate through the gate process that you'll be ready by December, then the oversight group may recommend that your project moves to apply as an incubation project, so you're not completely out of the running. Or if you apply to be an incubation project and your project is not ready to be implemented by July 2019, so that's 2019, not 18, then the oversight group may decide not to continue the application through the gates. So just be wary of that nuance as you proceed. For out of scope within the implementation and incubation project space, there's been a few questions about readiness for implementation. And I think a good way to describe in-scope and out-of-scope projects is to refer you to the translational research pathway from the Translational Research Institute, TRI. If your project is situated within T1 to T3, then it's probably not the right proposal for round 2 clinical implementation project investment. But if your project aligns to T4, clinical practice, then this is the type of investment Queensland Health wants to make. So Google, if you don't know TRI, Google TRI Translational Research Pathway, and you'll see the pathway come up. It's a beautiful orange colour, so you can't miss it. Now, this same approach to the T1 to T3 also applies in clinical innovation projects. So that projects that are situated along T1 to T3 are really out of scope for round 2 clinical innovation investment. We appreciate that this isn't necessarily the traditional research view of innovation, that T1 to T3 is typically categorised as innovation for research organisations. And the reason for this is that QTHA round 2 is a clinical program. And so the focus is on innovation in clinical practice. So really that T4 element of the translational pathway. Now, the innovation stream is more open in terms of who can lead and apply, but whoever the lead is, they must have a partnership with Queensland Health and a Queensland Research Institute. Gate 2 is where this partnership will be assessed, and the commitment and depth of collaboration will need to be demonstrated by the close of Gate 2. Another question that has been asked about the clinical innovation stream is, how do we know how much to budget for? Because you've given us no idea of how much money you're going to invest in. And the answer is, at this stage, we don't know how much or how many innovation projects will be funded. But to help you with your application, I'd point you towards the out-of-scope examples at the bottom of the slide as an indicator. So these projects can't be any longer than 12 months, and QGHA are not able to fund capital purchases. So with that in mind, it is highly unlikely that Queensland Health will approve an investment for a new sequencing machine or the purchase of a new technology system. However, the trial or pilot of new technology systems or new sequencing tests that meet the essential criteria of the clinical innovation stream is something that would be considered. Now, here's the key steps for lodging your EOI. After you've read all the specifications and you're ready to go, here's what we need you to do. Go back through again and make sure that your application aligns with the EOI guidelines, or your thinking aligns with the EOI guidelines. Complete the EOI template, and I'll talk you through that in a moment, and then lodge your applications to projects@qtha.org by midday, again, midday, that midday deadline is essential, on the 29th of June 2018. If you want access to all the round 2 documentations, there's the link below, but qtha.org, click on the round 2 tab, and that whole page will talk you through the process and direct you to the templates and also the guidelines. So what does the template look like? Basically, you should be submitting no more than 7 pages of content. That's what your project should look like at the end. So the first page is the EOI cover page. Pages 2 or 3 of your EOI should be your executive summary. Page 4 should be the project benefits and outcomes. And pages 5 to 7 should be the project overview, which provides us with the indicative gate. Now, we've tried to make the EOI process a very lightweight process. So let me talk you through the essentials now. You must complete the EOI cover page. The checklist on the cover page is more for your information than anything else, but we want to make sure that you and any currently named participants know what you're signing yourself up for in terms of the gate process from June through to November, December. We do need, as a minimum, the project lead's signature, the project sponsor's signature, but we do not need the lead organisation's CEO's signature at this stage. A word of caution, however, is that some organisations are running an internal process where the CE or the CEO is wanting to review and sign off on applications before they are submitted at Gate 1 in the EOI. So please do check your internal organisation's requirements before you submit. Regardless of that, we do recommend that you notify the CEO that you'll be submitting an application anyway. If you're applying for implementation or incubation, then following the stream specifications, you would be a practicing clinician. Therefore, the CEO sign-off that you would need to get would be the chief executive of the hospital and health service in which you're operating. Or if you're a clinician within a private hospital, then it would be the CEO of that organisation or health organisation. Gate 2 is where you must have formal CEO sign-off. So again, providing early notice to your CEO that you want to run a project in their hospital will no doubt pay off when you're working towards gaining the CEO and the organisation's support and sponsorship in Gate 2. The other element I would bring to your attention there is that if you're suggesting that you're going to run a clinical project in Roma, we will also need the CE of the Roma Hospital and Health Service, and I think it's called Central West, to sign off, Northwest, HHS, to sign off on your application as well. So you might also want to give a heads up to the CEs of all the hospitals in which you are hoping to operate your project. The second section of the EOI is the executive summary. You must complete the executive summary within the headings provided. Please do not delete any headings and please don't add to them. We want consistent templates going to the advisory panel. The word count under each heading in the EOI template is a guide only. You can have more or less words under the headings as you see fit, but the executive summary has a maximum of 2 pages. Please do not spend time writing a lengthy 3, 4 or 5 page executive summary, as these applications will not be submitted to the advisory panel or the oversight group. The next section that will require a fair bit of thinking and work in your EOI and must be completed is the project benefits and outcomes. Please consider the benefits and outcomes within the QTHA 4 outcome themes: patients and community, clinicians and clinical practice, health system and research. You can dot point your answers here, but no more than 1 page, please. Again, applications that go over the page limit won't be submitted for review. Now, those first three sections are what you must complete. The last section of the project overview is where we ask you to provide preliminary information to help to start to prepare you for the upcoming gates. Now, this section is the project overview section. I'll talk you through the criteria in a moment, but I want to say now that the project overview section will not be assessed. It's not part of the criteria. We really just want to capture your initial thoughts so that we can work with you to continue to develop these areas. It gives us the information that will help guide you through subsequent gates. Please do not leave any of the questions blank. If you haven't developed that part of the project yet, that's okay, it's not a problem. But note down that it requires further development on the application. While the section is not accessible, the advisory panel will still review the project overview, and they may be able to provide some advice or recommendations to help you prepare for that gate. So whatever initial work you do have, please note it down. Do not leave any sections blank. These sections also have a maximum page count, and to free up space, you're welcome to delete the italic prompts at the top of each page, but please stick to the page maximum amount. The final questions of the project overview ask you to consider your project's capability needs and how you might inform and consider key capability areas. And I'm about to spend a small amount of time now talking you through the genomic adoption framework and the second element of the round 2 funding, which is the QGHA Capability Work Program. So here's the genomic adoption framework that's been devised. Now this framework guides the investment that QGHA will commission from capability suppliers. Some of this activity will support the round 2 clinical projects. Now, as I mentioned earlier, we have shifted from a discovery round to targeted clinical projects and commissioned activity to advance Queensland's health infrastructure and capability. The genomic adoption framework will guide investment decisions for the capability building program. It's also got $3 million allocated, similarly to the clinical projects, and they'll fund 2 areas of work: the support for the clinical projects and capability building activities for core Queensland health functions. Similarly to round 1 projects, Each clinical project will require elements of capability to support the project. These requirements need to align to the genomic adoption framework you see on your screens. Again, we're not expecting full details in this final section of the EOI. We really just need your initial thoughts on what your project might need. For innovation projects, for instance, there may not be too many requirements and you might be relatively self-sufficient. For implementation and incubation, you will likely have different needs and require more support. If you're applying as an incubation project, have a think about whether you might need some of these capabilities as part of your readiness process. For example, do you need health economics advice and support to evaluate some assumptions you have about your project or to help you design an economics framework? Or do you need support to assess which is the best genomics test for your proposed model of care? This is what the capability support is supposed to be for in round 2. In Gate 3, we'll focus in on these capability needs and we will commission capability supplies as part of the capability building program to undertake activities to support the clinical projects. A word of caution, however, the QTHA budget is not infinite and the clinical project's needs will be weighed up against the other element of the capability building program, which will be commissioning activities to support capability development with core Queensland Health functions. You may find if your needs are extensive, at Gate 4, the business case and feasibility analysis, the oversight group may alter your clinical project budget to fund your capability needs out of the clinical budget rather than the $3 million capability building program budget. So in summary, don't approach this section as a wish list of everything I would ever like to have in a project, but do list what you need and you require to achieve your project's outcomes. So now that you know how to approach the EOI, what are you actually being assessed on? Well, as I mentioned earlier, you're being assessed primarily on the executive summary and the project benefits and outcomes. These are the key areas of the EOI, so it's 3 pages in total is what you will be assessed on. Within these sections, we will be asking for the advisory panel's opinion on whether you have aligned your project to QGHA's objectives, aligned your project to QGHA's round 2 investment principles, and you can find these investment principles on our website. They're also contained in the EOI guidelines. We'll also be asking the advisory panel whether you have addressed QGHA clinical project investment specifications, especially the essential criteria and the must-haves within the project scope sections. You must have demonstrated health need and project implementation evidence. And you also have to have clearly articulated outcomes within the 4 QGHA outcome themes: patients and community, clinicians and clinical care, health system and research, and thereby showing that you're maximising Queensland Health's return on investment. The final element you'll be assessed against is the readiness to progress to Gate 2. Now, the final criteria might seem contradictory to the advice I gave earlier where I said you're not being assessed on the project overview section. So let me explain further. You should have demonstrated in your executive summary and project benefits and outcomes section that you have a well-formed project. If you're applying for incubation, you still need to have a clear idea of the what, when, why of what you want to do, and this should come through in the exec summary and project benefits and outcomes section. If, however, you're at a stage where your application sounds a bit like this: we're a group of clinicians who think something should be done to provide genomic medicine to patients who have diabetes from a South Pacific Islander background. We think this is important as the patient community is greatly impacted by chronic disease. Then, whilst you are certainly correct that this is an area of need and something should be done, you're probably not going to meet the criteria for readiness to progress to Gate 2. While I'm providing examples of what wouldn't meet criteria, I'll also give you another example that speaks more to the criteria above the readiness dot point. Now, it's a bit of an extreme, silly example, but I do so purposely so that I don't name any existing projects that might be out in the world, but it gives you an indication of what's going to stack up for Queensland Health. So, for instance, if your project is wanting to sequence foot fungus, and the outcome is that you'll produce a publication and contribute to international foot fungus data registries, then QGHA is probably not the right program for you. Round 2 clinical projects are all about genomics in clinical practice with the aim of accelerating the translation of genomics into standard care. So that's the core goal for round 2 and round 3 for QTHA. And if you stick to that focus, then you'll do well through the gates. So as the countdown begins to midday, 29th of June, the QTHA Business Team are here to help. If you connect with us early, we can help you shape your EOI. Quite a few applicants have been in touch already, and the team has been busy meeting clinicians, industry partners and research institutes to help with their application development. So please don't be a stranger over the next 2 weeks. If you have any concerns or queries, please contact us via projects@qtha.org. As the gate process progresses, we'll be continuing to work closely with applicants to co-design projects. So the earlier we understand what you want to achieve, the better. Now, in a second, I'll unmute the mics so that we can answer any questions from the floor. But first, I'll answer any questions that have come through the chat function, and Katrina's shaking her head at me. No one's used chat. So I'll now unmute the mic, and if I can, and we will take any questions you might have from the floor. So if there's any questions out there, if you don't have a question, can I just ask you to mute your microphone so we don't get any feedback? Any questions out there?
Yeah, I have a question.
Yep. So who's this?
This is Amy. I work at UQCCR in breast genomics. Look, I was just wondering, after you get through the first gate, what level of attrition is there likely to be at each gate, or is the idea that you would be helped through?
The idea is you would be helped through, but you know, if you have come through and you really haven't met that essential criteria that we have stated in the project specifications, it's highly unlikely you will be selected to progress to gate 2.
Okay, sure.
Yeah. Any other questions? No? Okay, well that's easy done. If you do have any questions in the meantime, please don't hesitate to get in touch. We'd love to hear from you, and we are here to help. So we will be running this webinar again at midday, so if you're a sucker for punishment, let us know if you want to sit through the same presentation, or if you have colleagues who you think might benefit from sitting through, that would be great. But otherwise, we will close out now, and thank you very much for your attendance. Again, qtha.org if you want to get access to all the information, and the FAQs, the recording and the presentation will be made available next week. We'll also be releasing an FAQ today of all the questions so far that have come through from applicants. So thanks very much for your time this morning.
Thank you.
Thanks.
Thanks, everyone.
Thank you.
Bye.
Thank you.
Thank you.